My name is Holly Waters. I'm 52 years old now. I was diagnosed when I was 8, but I have not had any genetic testing. They just did the diagnosis based on my symptoms at the time and the fact that my mother has the disease, Charcot-Marie-Tooth Disease. It was a physical challenge in that I had my first surgery when I was 9, and some surgery on my feet and to lower arches, and then again when I was 13, and I had casts on my legs for quite all summer long one summer, and so my muscles in my calves atrophied, and then my legs, and then after that I wasn't able to run or jump or tiptoe or anything. So it was very much of a challenge because not able to do the things that you know, up until 2nd grade I was able to run in races and skip and jump and climb trees, and then everything changed. I think the first symptoms I remember having as a child were turning of the ankles, and I had really high arches, and so walking became uncomfortable, and I was turning my ankle a lot, especially my left side. I would just be walking, and then I was walking on the sides of my feet, and so that's why, because the ankles, the muscles in the ankles deteriorate, and then also the what's called foot drop, and so it's like, you know, we're walking along, and then all of a sudden your foot just gets caught, you know, boom, you fall, you know, so. And then later it was just all over physical weakness, but because of the weakness in my legs, then the rest of my body was trying to compensate for that weakness. And then I started having trouble with my hands and my arms. Surgical treatment to prevent deformities and to give my ankles strength. They did an ankle fusion. And they did some tendon transfers in my toes, but that was not something I know now that they should have done, because I lost the function of all of my toes, and my big toe in particular, and your big toe is what helps you to balance. And so I've lost that early on, what has helped me later in life are the AFOs, ankle foot arthroses, and now I started having a lot of knee hyperextension, and so I had to get braces for that also, that now I incorporate with the AFOs. But I'm able to walk, because without these, I have a very difficult time walking.